conference will start at 1.
All right, perfect, thanks.
is now starting. All attendees are in listen-only mode.
All right, so it sounds like we're ready to go. Are you guys ready to go? Okay, thank you very much. Good afternoon, everybody. Welcome to the Maricopa County press briefing for Wednesday, July 15th. My name is Fields Mosley. I'm the Communications Director for Maricopa County, also the lead Public Information Officer during this incident command. So I'd like to thank all the reporters. They're joining us either through the live feed we have here. We also have many of you joining us by Facebook or YouTube or on the webinar. We appreciate reporters being here, members of the public being here to get some information this week on a particular subject. So thank you so much for being with us today. You know, it was last month that the Maricopa County Board of Supervisors approved several broad categories for the CARES Act money that was given to Maricopa County by the federal government, by Congress. Those include, among many things, homeless response and prevention, and also small business assistance. The total dollar amount of those two categories so far, anyway, is more than $63 million. So today, the Director of Maricopa County Department of Human Services, Bruce Liggett, will explain the rental assistance program that just launched on Monday. We have a lot of partners involved in this, and he'll explain that a little bit more. But we certainly anticipate this will help out more than 6,000 households in Maricopa County. Afterward, I'll give you a brief update on the small business and small nonprofit grant program that launched last Thursday, and another large program that we're doing with the help of partners as well. So I'll give you an update on where we are in that and how much money has already gone out in response to those applications. And then we will open it up to questions. I do have Dr. Rebecca Sonnenschein. She is our medical director and infectious disease specialist at Maricopa County Department of Public Health. She is available to answer some questions if your questions are public health oriented today. We, of course, planned the presentation about the small business program as well as the rental assistance program. So we hope you'll direct most of your questions into those areas. Quick reminders for members of the media who have questions on the webinar today. We use GoToWebinar. Obviously, you know that. You're logged in right now. As many of you know, sometimes when you click to raise your hand, the program doesn't react right away. Give it a second. But if you're having continual problems with the software, go ahead and log out, log back in, and we'll try to get to your questions. When you raise your hand, please unmute your phone or your computer so we can hear you when we unmute you on this end, and so we can hear your questions here in the room. Please ask one question at a time. That's a little bit easier for us to answer, and Joanna Molina is also here from Public Health. She will be translating into Spanish. That's also very important. So if you ask one question at a time, we're almost always able to get around to those second and third questions. So we'll do our best to get with you there. So finally, our interpreter, Sarah, has a new clear mask on today, and we're trying out this newer mask. But facial expression is very important for grammar when it comes to American Sign Language. She is going to use this new mask, and we hope that it works. But if she has to take it off at some point during this just because it fogs up or anything else or it's uncomfortable, she will do that only because we certainly have a degree of distance here, and it would only be so she can express properly in American Sign Language and make sure everybody's understanding what we're saying to that today. So with that, I invite Bruce Liggett to come up and talk a little bit about the rental assistance program that just kicked off.
Thank you, Fields. As Fields said, in June, the Board of Supervisors approved funding for rental assistance for families who are experiencing financial hardship due to COVID-19. The goal is to minimize any disruption of families and their households, any displacement or evictions. That's the overall goal. We estimate to serve up to 6,000 families who have rental obligations between March and December. That, of course, depending on the rate at which we expend the funds. So based on fund availability, the program can continue through December. The county COVID rental assistance program will not be operating in Phoenix and Mesa. They directly receive their own CARES funding. So the program is administered by the County Human Services Department. And what we're doing differently, it's a big county, 4.5 million people, spread out, large distances. So we're going to rely on the network of local service providers, both cities, towns, and nonprofits, to deliver, as we have through our Community Action Program for decades. We've got 11 different entities that are working with us on this. Cities such as Avondale, Gila Bend, Surprise, Tolleson, Guadalupe, Scottsdale, and Glendale, and nonprofit agencies, Tempe Community Action, Ascend in Chandler, and FSL that is serving Wickenburg and Peoria. So those are the local agencies that are going to be administering the program on our behalf. We've allocated some of the $30 million, up to $2 million for funding for additional staff, and we estimate that we're going to have between 75 and 80 people working on this program throughout the county. We've operated multiple grants for a long time, serving a variety of needs to low-income families and households. It's a complex array, but by applying through community action programs, they can also access 7 different utility assistance programs we operate and 2 other rent assistance programs that we operate. So one of the objectives was to simplify this as much as possible and yet be clear that we're operating a program with integrity and we're taking serious our role as fiscal stewards. So there was a balancing act. We don't want something so complicated that it slows down the process and get to the people that have an urgent need. And we understand the devastating social, economic, and personal impact of the COVID-19 crisis on so many of our county residents. We also are aware of the expiration of the federal and state eviction moratoriums and the likely run out of the extended unemployment insurance benefits, all hitting at the end of July. It was really important for us in an incredibly short period of time to bring up a program before those dates hit and to be fully up by August when we expect a large number of people to request assistance. So the funds are only going to be available for 5 months, and it's a lot of money in a 5-month period. We're going to have to be spending at a $6 million per month clip to utilize all the funds. And yet we're aware of other programs that in a very short period of time have had more applicants than the funds they had could support throughout the country. That's been happening. We're going to monitor the utilization of these funds on a regular basis, daily, weekly. We can probably have monthly reports as we begin to roll this out, and we're going to make adjustments, and we're going to change program requirements if necessary also, if some prove to be too burdensome. So what's different about this than the other programs that we run, the anti-poverty programs we run, some of the features are this is a higher level of eligibility than our typical programs that are poverty level or maybe 200% of the poverty level. This income was set at 100% of the area median income, which is equivalent to 300% of the poverty level. We're going to pay set amounts of money. The calculations to determine what amount is due and what part may be fees and other items also slows down the process. So we're going to pay $1,500 a month, and we determine that number by looking at median cost for rents, for apartments, 2-bedroom that can support a family, as well as rental homes, and that's how we determine that. We're going to pay landlords directly, so landlords will verify that that is the amount due to them. They'll submit a form that will do that, and also, based on the demand that we expect, we're making a point that retroactive payments are going to be allowed. We think we have limited documentation required in terms of just evidence of the COVID impact on the family, which is required by the federal funding source, the CARES Act funding, photo ID, lease agreement, and household income. There is no family share of costs in this program. And I mentioned early utility assistance, so we're going to be bundling our services. Many families can also qualify for help with their utility bills during this time. We feel if we provide comprehensive services to family, they'll be better able to prevent evictions and be better able to support their families. The beauty of working with the local agencies in their communities, they're known, they've got a great reputation for delivering high quality service and access other services in their community. Transportation services, food bank, clothing banks, those kind of things. So we're going to make available to families who apply broader services if they request those. If not, if they just want rental assistance, they'll be able to do that too. So the demand is unknown. I think we've all seen estimates that have been that there'll be a minimal impact up to hundreds of thousands of people impact. So we're going into an uncharted territory in terms of what we'll know. But we know that there's hundreds of thousands of renters in the area of Maricopa County, exclusive of the city of Phoenix and Glendale. Over 300,000 renters in the area. So we also are aware that local communities themselves are developing rental assistance programs. So we're going to work with some of the other funders to put together a comprehensive list of all the different sites for everyone in Maricopa County where they can go to get assistance, to try and clarify for that. Applications are going to be taken and served on a first-come, first-served basis. We're committed to doing this as quickly as possible. We appreciate everybody's understanding, and I would urge all renters to stay in close contact with their landlords. If you're speaking to your landlord and they know that you're applying for county rental assistance funds, you may be able to work out arrangements to not disrupt your living situation. So we encourage you to do that. For more information about this program, we'd go to maricopa.gov/COVID rent help. maricopa.gov/COVID rent help. Or contact your community action agency, which is also on that website. You'll be able to see all those communities I named earlier there and understand how to contact them. Thank you.
Thank you so much, Bruce. A lot to unpack in that statement. There was a lot going on there. So again, we'll have time for questions and answers here shortly. I want to give you an update right now, though, on the business grant, small business grant program, and it also includes nonprofits as well, which I think is important. This was very important to members of our Board of Supervisors when they created this program. Maricopa County and the Board of Supervisors specifically, the primary focus has really been on the health emergency ever since it came to be when we had our first case in January. The board understands, though, as everybody does, and what Bruce was talking, there's a huge economic impact going on in our county and all of our communities. The county typically supports economic growth in different ways than cities do, through balanced regulatory policies, not direct support to business. So this was a new frontier for the Board of Supervisors and for county staff as well. So we have a partner in this in the Arizona Community Foundation, but I'll give you a quick update for how the small business grant program is working right now. Since Thursday, when this launched, we've had 110 applicants already approved and receiving money. The total amount of grants as of today is $893,000. That's in just 4 business days that has been granted to various nonprofits and small businesses. So if this is the first time you are hearing about this, I'll go through some of the basics about this program. It provides a grant up to $10,000 to small businesses and small nonprofits that have been impacted by COVID-19. We're using $23 million in CARES Act funding to pay for this. This is on a first-come, first-served basis. And this includes all businesses and nonprofits outside of Phoenix and Mesa. The same, for the same reason that Bruce explained on the rental assistance program, Phoenix and Mesa, both very large cities, also received CARES Act funding, and they also have business support programs as well. So the applications, they started being accepted last Thursday, and I'll give you the website really quickly, but it was in our press release and certainly on our website, azfoundation.org/Maricopa Relief. And to qualify for this, a small business or a nonprofit has to have 25 or fewer full-time employees, saw gross revenues decline by 25% in March and April from the previous year, also did not get any other COVID-related government assistance to stay afloat during this time. So if you have any questions about that, I'm happy to answer that. This is the portion where we'll open it up to questions and answers. It looks like Sarah is doing very well over here with her new mask that we were able to provide, so we appreciate her assistance today. Once again, Bruce is open to questions about rental assistance. I'll do my best to answer questions about the grant program that is ongoing, but it certainly seems to come out of the gates very quickly. So, Chad, do we have anybody on the line?
We do. Nicole Grigg has a question.
Okay.
Nicole, your microphone is self-muted. There you go.
Okay, I think I got it open.
Yeah.
Sorry, I missed the very beginning because I had troubles logging on. Is Dr. Sonnenschein here? If not, Fields, could you please address what is happening inside the medical examiner's office? As of Friday, it was at 96% capacity. We're now hearing that funeral home directors are getting calls from the ME asking if they have cooler space. You guys only had 6 spots available for bodies on Friday. What's happening today, and what are you guys doing to add capacity?
Happy to do that, Nicole. That doesn't really involve Dr. Sonnenschein, but I can answer that question on behalf of the Medical Examiner's Office and the Unified Command. So as of Friday, we are at 96% of normal capacity. Normal capacity is 150 decedents. But we have a surge capacity up to about 209 decedents. So really, we were in the 70th percentile range. So at that point, we have seen a larger number of decedents over the last few weeks. This is a cause of concern, but as of today, we are at 156 total decedents out of that 209. So that's 78% of our total capacity. That being said, that puts us into a range of surge. We're entering our surge capacity, and as we had planned for, if we needed to, we already had contracts in place to deal with this and bring in portable coolers as necessary. Because we don't want to hit any sort of capacity situation, we have placed orders and should have portable coolers in place either today or tomorrow. 4 coolers have been ordered initially, with more potentially being ordered in the next few days. 4 coolers will give us extra capacity for 60 bodies. And again, I explained this a lot on Friday, but I'll say again, this is to deal with capacity at the medical examiner's office. I think it's important to note that this is an entire system. Hospitals have coolers, funeral homes have coolers, medical examiner's offices have coolers. So bodies come into the medical examiner's office, they go out to funeral homes after autopsies are performed or investigations have begun. So it's important that this entire system is working properly. Yesterday, because we hit that surge capacity, multiple phone calls were made to funeral homes all over the county to try to assess that their ability to make sure they were taking bodies in a timely fashion so the medical examiner can keep doing the great work that they're doing over there. With that, I'll turn it over to Joanna Molina to translate really quickly, and we'll get to the next question. Thanks for the question, Nicole.
La pregunta es, ¿qué está pasando en la oficina del médico forense? Si está a 96% de capacidad, que estuvo el viernes, y ahora ¿a qué capacidad está para hoy lunes? Sí, 96% de capacidad tenía hasta el viernes pasado, lo que significa que pueden tener hasta 150 cuerpos en capacidad en el médico forense para poderlos tener dentro de ahí del médico forense. Sin embargo, existe la capacidad para, en cuestión de emergencias, hasta para 209 cuerpos que puedan tenerlos ahí. También hemos visto que ha crecido el número de necesidad para poner más cuerpos en un sitio refrigerado. Entonces, al momento, el 78% de toda la capacidad se está utilizando y se han ordenado nuevos refrigeradores, al menos 4 de ellos que empezarán a llegar hoy o mañana para tener capacidad para 60 cuerpos más. Entonces, se ha estado trabajando con las casas funerarias, con hospitales, y también el médico forense ha hecho estas llamadas para saber que ellos están recibiendo los cuerpos cuando sean transportados a las casas funerarias.
All right, again, Nicole, thank you so much for the question. We appreciate it. Chad, do we have somebody else?
We do. Our next question is from Peter Seymour. Peter, your microphone is self-muted. If you'll unmute, you're ready.
Yes, good afternoon, everyone. Hopefully you can hear me. I understand Dr. Sonnenschein's in the room. I wanted to ask her for a brief update on coronavirus in the county. And specifically, there's a study out of Georgia Tech, a dashboard, if you will, that estimates if an event today had 10 people, there's a 57% chance of encountering someone who was infected with COVID-19, and that estimated risk level as an event of 100 people would exceed 99% of possibly contracting COVID-19. So I know that's a multi-pronged question. Thought I'd get it all in now. Any help, any answer would be appreciated.
I think, so Dr. Sonnenschein can respond to our direct numbers. I don't know that she's had a chance to look at this particular study. As I'm sure all of you know, there's plenty of studies out there, and it's very difficult to consume all of them, but Dr. Sonnenschein can answer that question.
Ok,
Good afternoon, and thank you for that question. I'll start by just responding to the first part of your question, which is a general status update. And what's important to know is that we had just over 2,700 cases in the last 24 hours. And what we're seeing is that our average number of cases is right around 2,500 cases per day. And that is slightly decreased from what we were seeing right around the third week of June, when the mask requirement was initiated by Maricopa County. That was also around the time that the governor closed bars and gyms and did some other things. But what we found is that just about 2 weeks after those events occurred, we started to see a decrease in the number of cases. And that is what's referred to as a slight flattening of the curve. What we don't know for sure is how prolonged that flattening will be. We hope that it will continue to decrease, although it's much more clear that it is a flattening right now. And we do anticipate that we're going to see a flattening or a decrease in hospitalization data coming up in the next 1 to 2 weeks, and then followed by 1 to 2 weeks later, hopefully a flattening and a decline in the death rate, because those always lag a couple weeks behind each other. So that's our general status update. I can't comment on the specific study that you referred to, simply because I haven't read it in full, and I'm certainly not one of the co-authors. What I can say is that the general concept of knowing that if you're going out in public in a large group of people, there is a high likelihood that you will be exposed to COVID-19. Wearing a mask, we've gotten much more evidence even over the last few days that wearing a mask definitively can prevent you from getting COVID-19. It's not perfect. Distance is always going to be better, but masks work very, very well, and we've got good data to show that wearing a cloth face covering will actually prevent you from getting disease most of the time.
La pregunta es de una actualización acerca de COVID-19 y también acerca de un estudio que ha salido de los datos de Georgia y que demos nuestra opinión en cuestión de salud pública. Contestando la primera pregunta en cuestión de los números y la actualización en el condado Maricopa, aproximadamente se ven 2.700 casos en 24 horas. En las últimas 24 horas es lo que hemos visto. Es un promedio de 2.500 en lo que hemos visto por día. Esto desde junio ha bajado cuando entró la regla de utilizar la mascarilla y también el cerrar lo que viene siendo gimnasios y bares. Hemos visto que han estado bajando los números que se han reportado diariamente. No sabemos qué tanto estos números se irán bajando en las próximas semanas o si se mantendrán con un índice de esta naturaleza, pero creemos que esto se va a reflejar también en el número de hospitalizaciones en las próximas 2 semanas y que ojalá que continúe disminuyendo ese número. Con referencia al estudio que se muestra de Georgia, se ha dado a conocer que el concepto de que vayamos a salir a la calle y por ende estamos en riesgo de poder contagiarnos con COVID-19. El uso de la mascarilla reduce el nivel, el riesgo de propagación que podamos tener y de contagio. Hay numerosos estudios que han mostrado la evidencia de que podemos disminuir el riesgo con el uso de la mascarilla. Y eso es lo que estamos promoviendo en este momento, el uso de la mascarilla.
All right, thank you, Peter, for the question today. Who else do we have on the line, Chad?
Courtney Holmes has a question. Courtney, your microphone is live.
Hi there, can you hear me?
We can.
Okay, I've got a couple of questions for you. The first is that the county got this money in April, the CARES Act money. It is now July. Could you please talk about what the 3-month delay was in getting this money out? And my other question is, do we have the authority to put a moratorium in place in the event that the governor allows his executive order to expire, the one that postpones evictions?
So, just to clarify, Courtney, you're asking if the board has the authority to do an eviction moratorium similar to what the governor has done by executive order?
Exactly.
I can't answer that because I'm not a lawyer, but I'm looking at Bruce. Have you ever explored that? Okay, we'll have to get back to you on that, Courtney. There are a number of things the Board of Supervisors can do, but I would just be speculating as to whether or not they have that power under state law. I don't know that without researching that. As far as any sort of delay, as I explained to you in my email today, yes, we, along with Phoenix, Mesa, the state of Arizona, Pima County, they all received CARES Act funding in early April. At that point, the Maricopa County was already spending a great deal of money standing up, helping the Human Services Campus, for example, efforts to create separation for people experiencing homelessness, renting hotel space, motel space to allow people who either were at risk or sick to have a place to go so they weren't congregating on the Human Services Campus or any other shelter environment that was out there. We were also pouring a great deal of effort through public health into long-term care facilities, disease control, that sort of thing. So all these things were going on in March and April before the CARES Act money arrived. So once it did arrive and we knew how much there was a lot to consider here because we have a Department of Public Health. No other cities and towns in the state of Arizona have a Department of Public Health. So it's up to counties. They have the Department of Public Health, and there's the state level, of course, with Arizona Department of Health Services. So in coordination with them, what are we going to do with this? Is the state going to come in and help cities and towns that didn't get CARES Act money? So any city and town under 500,000 population did not get CARES Act money. So ultimately, it was decided by the state to share money with those cities and towns so they were able to address issues particular to their location. And so at that point, the Board of Supervisors knew we weren't going to have a commitment to those other 24 cities and towns in Maricopa County, at least not with direct payments to them. So that gave us a better idea of how much money we were looking at. And as I explained, the wheels were already turning on many of these programs. How would we divide it up? Much of this we don't know. We've never had a pandemic in the modern era like this, of this size. We don't know what money we're going to have to spend next. So there's some money set aside. A lot of this money has been allocated into broad buckets, if you will. I mentioned two of them at the beginning of this. And then, as Bruce explained, he was already well on his way. He had staffed up to help release the money or approve applications for the state money that was provided for rental assistance or eviction prevention. And so he had some repurposed staff already doing that, and now we are full on implementing this program that was stood up in 6 weeks that would probably normally take about 6 months to do. You're talking about 11 different community action programs that are out there, and they are good partners in all this, but they had to be communicated with. They have to be partners that are brought into this. They know what the requirements are, and they're the ones that are going to be taking in applications and helping us approve those and getting people the help they need faster. So I hope that answers your question. Thank you. And I'll let Joanna translate that very long answer. Sorry, Joanna.
Bueno, son dos preguntas. La primera, si el dinero del condado llegó en abril, porque hasta ahora en junio es cuando se está otorgando. La primera pregunta. Y la segunda, si la Junta de Supervisores tiene el poder de crear un moratorio para evitar desalojos como lo está haciendo o lo hizo el Estado. Vamos a empezar por la segunda pregunta. La contestación es no sabemos, tendría que investigarse. Nunca hemos estado en una pandemia de esta naturaleza, así que hasta ahorita la Junta de Supervisores nunca ha creado un moratorio de esta naturaleza. En cuestión del dinero del condado que llegó en abril y por qué hasta ahora se está otorgando. Bueno, los fondos de CARES Act que llegaron a diferentes condados, a diferentes ciudades, incluyendo a Maricopa, el condado Pima y a otros anteriormente, se estaba utilizando para también el salud pública y el condado utilizando para rentar espacios para ayudar a personas que son vulnerables, personas sin hogar, también para el control de enfermedades en instalaciones de cuidado médico. Ese dinero se estaba utilizando desde marzo. Cuando llegó en abril tenía que invertirse y pagar en esas áreas. También se tenían que tomar en cuenta, pues obviamente, los gastos que se iniciaron desde marzo. Ahora los fondos que se van a utilizar Sabemos que 24 ciudades el Estado les está asistiendo. Entonces, ahora el condado no puede proveerles dinero a esas otras 24 ciudades, pero sí estamos trabajando para ayudar, como se mencionó anteriormente, está utilizando para ayudar con el alquiler o evitar desalojos de personas en los próximos 6 meses aquí en el condado Maricopa. Y se está trabajando con infinidad de agencias que a eso se dedican y que tienen que tomar las solicitudes y poder ayudar a la comunidad.
Thank you so much for the questions, Courtney. Chad, do we have somebody else?
We do. Mike Pelton has a question. Mike, your microphone is live.
We got the ABC 15 show today.
Yeah, hey everyone, I think you guys can hear me.
Sure.
Question for Dr. Sonnenschein, and I know you already addressed cases and deaths, what we might see in the coming weeks. Arizona's R0 number, I know there's a lot of people who look at this website who tracks that, and today it has Arizona finally in the green, under 1. I think it's at 0.97. Question is that good enough, and is there any indication in the data here in Maricopa County that would show, are the measures that are currently in place enough and sufficient enough to actually start driving cases down to a more manageable level?
Are we talking about the R0 measurement that's out there, Mike?
Correct, Fields. The site RT.live, I know a lot of people track that. It has
Sure.
Arizona under 1. So one of my questions would be, is that good enough? And are enough measures in place to see numbers start going down to a more manageable level?
Okay, Dr. Sonnenschein will take that question. Thanks, Mike.
All right. Thank you for that question, and it's a really important question. We're all watching our numbers very closely. As I mentioned before, there's a couple of measures that were put into place right around the third week of June, including the mask requirement Maricopa County wide, as well as closing of bars, gyms, and tubing, and some other things. And we know that it takes 14 days for those measures to take place. So at that 14-day period, that is exactly when we started to see a decline in our case number, as you mentioned. And what we follow very closely is the R0 that you discussed. The specific R0 that you mentioned on that website, that is one of the data sources that we do follow, and I know that I have talked to a number of experts who think that that estimate is reasonable, but you do have to know that all of those estimates are based on a lot of different data and a lot of different assumptions. So I don't put all my eggs in any one R0 basket. I want to make sure that there is no universal R0. That being said, that is a reasonable site to go by. Our goal is to get the R0 less than 1. As you said, that site is showing that it is slightly less than 1. And as long as we can keep it below 1, what that means is for every person who's infected, less than one other person will become infected from that person, which means that the curve by definition is going to go down and that we will eventually get to 0. What I'm hoping for is that we will see a stronger decline from those measures, and that as people start to realize that this is a big deal and wearing a mask really does help. And with these recent studies over the weekend, there was one with 2 hairstylists who actually were infected, and they looked at a number of their clients, and because they wore masks, not a single person got infected. So as more data shows how effective masks are, we hope that the community will take that individual responsibility. We can continue to get that R0 less than 1, and that we will eventually get there where we can suppress the spread.
Bueno, la pregunta es que si Arizona finalmente se está viendo la luz verde, si acaso estamos llegando a números que se pueden realmente manejar y estamos quizás mejor para un futuro. Bueno, todos los números que hemos estado viendo se tienen que relacionar con algunas medidas de prevención que se han puesto. Empezamos que en junio el uso de la mascarilla se hizo regulatorio, al igual que también el cerrar bares, gimnasios y otros sitios. Toma alrededor de 14 días para empezar a ver resultados y es lo que hemos estado viendo en estos días, que han estado bajando un poco los números. En cuestión de qué medidas o cuál es la medida, cómo medimos si estos casos van a seguir de esta manera. Bueno, nosotros en este caso tratamos de ver los estudios, pero los vemos con cautela, porque no podemos decidir que un estudio en otro lugar es el mismo aquí en lo que viene siendo el condado. Sabemos que algunos estudios muestran que si una persona infectada solamente afecta a otra más, entonces estamos llegando a un nivel donde quizás la infección está reduciéndose. Esperamos que empecemos a ver resultados precisamente donde estos casos bajen. Ponemos, por ejemplo, 2 estilistas recientemente resultaron contagiadas con COVID-19 y al darse el seguimiento a estos casos, dimos cuenta que el uso de la mascarilla fue muy efectivo porque ninguno de sus clientes se contagió a pesar de que esas personas estaban contagiadas.
Mike, thanks so much for the question. Chad, do we have somebody else?
Oh, we do. Peter Seymour has a follow-up question for
Okay.
Director Liggett. Peter, your microphone is live.
Yes, thank you. So if the eviction moratoria were extended beyond next Wednesday, I know they're set to expire then, would this have any impact on the rental assistance program? Would the program be able to wait in some other entity, some other component of victims from the coronavirus crisis? Would they be getting help instead? Just wondering how this all factors and pieces together.
So just to be clear, Peter, you're asking if we would shift funding away from rental assistance if the eviction deadline would be extended by the governor. Is that correct?
That's correct.
Okay. Bruce will step in and answer that one. Thanks, Peter.
I think it's important to remember that the rental assistance program benefits not only the renters, but also the landlords who have mortgages to pay. And so I think irrespective of any continuation of the moratorium, it'd be important to know who's able to pay and who's not able to pay their rents, especially with the reduction anticipated in unemployment insurance at the end of this month. So I foresee this program continuing irrespective of a moratorium. It'd be good to get money in the hands of the landlords on behalf of the renters and strengthen that community. So that's how I see it.
La pregunta es que si el moratorio que vence el próximo miércoles en cuestión de pagos de alquiler del nivel estatal, si eso se extendiera aún más, si los fondos que ahora el condado está poniendo para ayudar con el alquiler o renta de viviendas cambiarían esos fondos. La respuesta es que todavía no se sabe, se tendría que ver hasta cuándo se extendería el moratorio y también si la gente pudiera pagar esos alquileres o renta y llegar esos fondos a los dueños de esos negocios o en este caso de esas viviendas o de esas propiedades. Entonces, todavía se tendría que ver en dónde se utilizarían esos fondos y si llegan a los dueños.
Thanks again, Peter, for the question. Chad, do we have somebody else with a follow-up?
We do not.
Okay. Well, if that's all the questions we have for today. Is there anybody else on there at all, Chad?
There are no hands raised at this time.
As I look at the speaker as it talks to me. All right, thanks, Chad, for your help with us today. Thanks, everybody, for joining us. We certainly appreciate it. I'd like to thank Dr. Sonnenschein and Bruce Liggett for joining us today. Great questions. We appreciate your time, and Joanna, too, for helping us out. So thanks again. We'll let you know when our next availability is and what subjects we'd like to share with you. And as always, we appreciate all the questions that you have for us. Thank you, and we'll see you next time.
All right, 1, 2, 3. Can you hear me? Can you see me? Everything's good. Yep. 1, 2, 3, 4. A, B, C, D, E, F, G, H, I. Great. Sounds good. Sounds good. It doesn't sound hollow like from the phone. Perfect. That's it. Thank you very much. Bye.